The authors suggest the main purpose of their research is to discover the effects of job satisfaction levels of mental health professionals, also called mental health counselors, preferably providing group therapy in state correctional facilities. The need of these mental health counselors have increased and will increase as the years go on, which is why the need of more mental health professionals is becoming increasingly necessary in correctional environments. Since most of the population in correctional institutions is made up of some prisoners with serious mental disorders such as mood swings, anxiety, or psychotic disorders, and generally excluded substance abuse disorders, were as cited in one of the sources the authors use that states that those mentally ill patients are disproportionately common in state prisons and local jails, where they account for 16% of the population. Another aspect of importance revealed by the author that to effectively navigate the demands required of them while working in a prison setting, psychologists need special preparation above and beyond the standard education and training. To assist the psychologist's roles and functions in this demanding work environment, including assessment, screening, crisis intervention, program administration, and the provision of direct services. The assumption coming from the citation said by the author is that mental health workers represent a unique and subsequently subspecialty with distinct job stressors and occupational variables within the correctional environment. Additionally, the source that the author uses creates a concern indirectly with how different parts of the correctional work may influence job satisfaction to further provide light towards the main goal of the study. Participants were given a survey that had variables that would explain the possible cause of job satisfaction or job non satisfaction. The authors examined how satisfied professionals worked with duties, including individual therapy, group therapy, formal assessments, crisis intervention, case management rounds, report writing case notes, administrative responsibilities, receiving individual supervisions, supervising other professional staff, and providing consultation services to professionals outside prison. This study included 162 mental health professionals working specifically in group therapy services. Participants include those related to administrative support, security demographic variables as they relate to how the psychologist rated satisfaction with working with group therapy as a job duty. Also, gender 100 men and 60 women, leading the mean age to be made up of 44-year-olds, race including mostly Caucasians, African American, biracial, Hispanic, Latino, Native Americans, and others. Ultimately, of the 162 participants, 22 had obtained a doctoral degree, 99 obtained a master's degree, and 38 participants obtained a bachelor's or other degree. Evidently, the survey used by the authors indicated as a result that prison mental health employees are generally satisfied with the various aspects of their jobs in correctional settings. They appear especially satisfied with aspects of their jobs that involve the provision of psychological services, although they appear relatively less satisfied with non-direct services including administrative responsibilities and report writing and case notes. The authors do agree with the survey results that, as one would expect, service providers would be the ones to be more satisfied with aspects of their jobs that include the provision of services to clientele, in which the key to job satisfaction is administrative support variables. The finding that mental health professionals emerged as less satisfied with the individual supervision they receive when compared to some of the other job responsibilities is a concern. This may be the result of a lack of opportunities for supervision activities in the prison setting, considering some 20% of group therapists do not receive supervision regarding the group psychotherapy services. But in essence, the final opposition and viewpoint seen by the authors suggests that administrative support showed that mental health professionals remain largely satisfied with positions and job duties in correctional settings. The only aspect that the other authors do wish for to make the opposition concrete is that there is few published studies that examine mental health professionals in the correctional settings, as well as a study being qualitative in nature and where some suffered from methodological problems, including restrictions to one or few prisons and a lack of random sampling.